In this ASCO meeting in 2018, there has been a patient-reported outcome session. And for the very first time, there has been run a trial where older patients with malignancies can report the way they feel and how they are experiencing adverse events when receiving chemotherapy. And it has been demonstrated that patients that actively report the outcome, how they feel or the adverse events, these patients are having more survival than patients that did not. So it's very important for us, for physicians, to identify very early these adverse events in order to make any decisions in temporarily interrupt the treatment, or maybe reduce the dose, or maybe delay the regimen. So for us, it's very important to receive this information from the patients in order to improve the outcome and, of course, the quality of life of our patients receiving chemotherapy. In this study, patients could report the outcome in different ways. The most commonly used were an app based in a smartphone or tablets, but also in internet, in their computers at home. But for those patients that don't have access to internet, there is also an option to report the outcome by paper, so they can fill formulas and they can send these to the physicians, or can complete them in the waiting room before they come into the doctor clinic. This information of patient-reported outcome is collected before the patient comes into the doctor clinic. And this is very important in order to make up any decision with the treatment, in order to decide if we should reduce dose or delay the next therapy. So for the future, physicians need more actively participation from the patients, and probably it would improve the outcome and survival and quality of life in our patients with lymphoma.